Good afternoon and welcome to today's Caregiver webinar, Caring for a Loved One with Cancer. My name is Allegra Jaffe, and I am a caregiver specialist with the Fairfax Area Agency on Aging. Before I introduce today's speakers, I will go over a few housekeeping items. You should have received an email this morning with the speaker slides, so you'll have them for future reference. We will also allocate at the end of the presentation a few minutes for you to submit questions. You can do this in the Q&A box on your Zoom panel. Also, we do have closed captioning available on your Zoom panel. You can press your closed captionings where it says show subtitles. Today's presentation is being recorded, and a recording will be sent within early next week or so to you. There will be a brief survey as you sign out. If you could please help us by giving us your feedback. And it's my pleasure to introduce today's speakers, Durene LeFlouria and Rebecca DiPatri. Durene is a licensed clinical social worker with more than 15 years of experience working in gerontology, palliative care, hospice care, and behavioral health. She earned her Bachelor's of Arts degree from Howard University and her Master's of Social Work degree, and looks like and a specialist in aging certificate from the University of Michigan. She is currently an oncology clinical therapist at the INOVA Cancer Institute, where she provides emotional support, individual and group therapy, and care coordination to oncology patients and their families. Durene's scholastic and clinical experiences have driven her professional commitment to helping others enhance their quality of life. Rebecca DiPatri has 20 years of clinical oncology nursing experience. She's earned her Bachelor of Science in Nursing at the University of Virginia. In her current role as an Oncology Nurse Navigator, Rebecca represents Life with Cancer on the inpatient settings on the INOVA Fairfax Medical Campus and co-facilitates support groups. Rebecca brings to Life with Cancer extensive clinical experience, unparalleled compassion, and the hope and support necessary to help patients and their families as they prepare for their life after diagnosis. Rebecca is honored to be part of this interdisciplinary team committed to supporting those affected by cancer. Durene and Rebecca are going to share their experience with us today. Thank you, Durene and Rebecca, and welcome.
Thanks, Allegra. We're really excited about being here.
Oh,
I appreciate the warm welcome. Let's get started. Okay. Thanks a lot. And again, Durene and I really appreciate being here. We're really glad, most importantly, that you took the time this hour out of your day as a caregiver to be here and take the time for you to hopefully learn a little something, give yourself a little break, and hopefully have a few takeaways to bring home with you that might be helpful for you. So Durene and I work at INOVA Life with Cancer. So our mission is to support individuals and families and caregivers affected by a cancer diagnosis. And Durene and I also co-facilitate our caregiver support group, which is offered monthly here through Life with Cancer. Today's topic is caring for a loved one with cancer. Just to review some objectives for our presentation here, we want, at the conclusion of this presentation, we want all of you out there to be able to define what a role of a caregiver is. We want you to identify and describe 3 ways in which your loved one's cancer can affect relationships, and describe 3 interventions and or resources that are available for support for you as a caregiver. I'd like to start with this, and I'm sure all of you here sort of already feel this, I don't have to tell you, but a cancer diagnosis is a diagnosis for the entire family. This isn't just a diagnosis for your family member, your friend, your loved one. It affects every member in a family. It brings challenges and changes to the family structure, familial duties and routines. It's a family stressor and creates distress, and caregivers can feel this intense stress and stressors, even sometimes greater than that of the patient or the person that they're caring for. We know that caregivers feel burdened and overloaded with these added responsibilities that caretaking of a cancer patient involves. And we know that there are changes and adjustments in responsibilities and roles within the family. As we as cancer care providers know, we have lots and lots of emerging treatments and new treatments that are helping people survive cancer longer, which is a great thing. But we also know is that the number of cancer survivors is increasing year after year. Most recent statistics show that there's 16.9 cancer survivors in the United States, and that number in the upcoming years is looking to exponentially grow as more treatments are helping people live longer. And, you know, with the number of cancer survivors increasing, we know that these bring lots of changes to different family units and caregiving roles. Caregiving may be different along the way on someone's cancer journey. You know, whether they're in different stages of cancer treatment, your role as a caregiver can look different in each of these stages. And, you know, we want you to be able to move and change and adapt to what challenges these bring. Caregiving continues through the whole complex continuum, and the roles and change as the course of the cancer or survivorship changes. Certainly, we know that in diagnosis, families, caregivers mobilize. You look to get information. You gather as much information as you can to sort of make these informed decisions that happen very quickly at the beginning of treatment. You're ready to be there as a caregiver. You're ready for that emotional support. As you roll into the treatment phase, you know, you may identify as a caregiver that there's a lot of changes in roles that different people, you included, may be experiencing. You know, you may be experiencing physical and emotional changes to this sort of course of treatment, whatever the period of time is. And certainly, a lot of caregivers can also develop a lot of distress during this time, sort of in this limbo phase, wondering, is treatment working? We're going through this treatment. It's causing all these changes, all these stressors, but is the treatment going to work? So this real emotional spinning can occur. Certainly during this recovery stage, this rehab stage next after active treatment, maybe a remission stage for your loved one that's going through cancer. This can be a long, slow adjustment back to life, but life may look differently. It may have changed. And, you know, learning to adjust yourself to these persistent or these permanent changes that have occurred secondary to the cancer. And certainly in this survivorship phase, you know, this fear of recurrence, this stressor not only for the patient or the loved one, but for you as a caregiver, you know, fearing going to doctor's appointments, fearing what the next scan or blood work might show. This again is another phase of stress as a caregiver you may be experiencing. And at end of life, as some of you out there may be making decisions about end of life or planning for end of life, certainly there's anticipatory fear and grief that you're learning to manage as a caregiver during this phase as well. Who is a caregiver? I probably don't have to tell you out there who a cancer caregiver is, but by definition, according to the American Cancer Society, cancer caregivers are most often the person that is helping out the person with cancer and are not paid to do so. You may be partners, family members, maybe close friends. A cancer caregiver has a variety of roles, and your role may be very different than a neighbor's role or a role of somebody else in the cancer center. I want you to know that you are a valuable member of the healthcare team. And I think sometimes this is forgotten. And we're going to talk about that in a little bit. as a cancer caregiver, you're a problem solver, whether it's sort of these really complex issues you're managing and trying to work through, gathering information, or on a day-to-day basis, the things that you're solving and doing on a day-to-day basis that are burdensome. You're taking care of daily tasks, and you're helping and advocating for the person with cancer. And I'm sure I can go on and on. This is just sort of a broad overview here. Durene?
Good afternoon, everybody. Thank you, Rebecca. I appreciate it. My name is Durene LeFlouria. I'm one of the oncology therapists with Life with Cancer. And I just want to kind of dovetail off of a couple of pieces of information that Rebecca shared with us here a short time ago. So our next slide refers a little bit more to who is a cancer caregiver. Sometimes people use this term to identify people who might have specialized knowledge, training, and skills, such as a doctor, such as a nurse, such as a therapist. But in the context of our discussion today, we're talking exclusively about those of you who serve in this role to take care of people that you serve as a lifeline for. You might be the child of someone that has cancer. You may be the spouse. You might even be the sibling. Perhaps you're the parent of someone that has a cancer diagnosis, but quite often people do not have specialized training for this job. And we understand the intensity and the importance of what it is that you do. As Rebecca highlighted earlier, you do serve in roles where you have to take care of people physically, emotionally, spiritually. And we want to talk to you a little bit more about not only specifically what those duties may entail, but we also want to make sure that we highlight some interventions that are going to be helpful for you, because we do understand that this is, again, an intense role, and it's one that requires, a tremendous amount of patience, and that's exactly what we're here for. We're also glad to answer any questions towards the end. In the next slide, we're going to talk about two areas with the roles of caregivers. Some of you may be familiar with these terms, ADLs or IADLs. ADL stands for Activities of Daily Living. IADLs is Independent Activities of Daily Living. Sometimes people refer to it also as Instrumental Activities of Daily Living. The two terms can be used interchangeably, but they essentially mean the same. With ADLs, we're talking more specifically about helping people with a lot of their physical needs. So this may be bathing, it might be dressing, grooming, toileting. With IADLs, we're looking more specifically at such things as transportation to the appointments, being that person to communicate, or as Rebecca said a few seconds ago, to advocate for the patient. This could be with anybody in the treatment team, communicating with family and friends. And with the IADLs, this has to do with managing such things as the finances, the household, and really making sure that you have a clear understanding of some of the challenges that might come along with the role reversal in relationships. That is generally something that we hear quite a bit about when we're doing the caregiver connection groups. I would not be surprised at all if there were questions that came up in the latter part about that, but we can delve more into that to the extent that you all might have questions about that. In the next slide, Rebecca's going to talk to us a little bit about the Caregiver Challenges, and then we'll talk a little bit more about strategies.
Thanks, Durene. And certainly, what Durene just reviewed, I think the list is endless. We could go on and on about the challenges, and everybody has their own independent challenges that they're managing on a day-to-day basis. But part of our role here is to maybe help you better understand challenges and better help you understand how to manage them. Certainly, first and foremost, almost everyone Durene and I probably talk to has questions about insurance and financial changes that may be occurring. We refer to this in our world as the financial toxicity of a cancer diagnosis. Certainly, you're managing the emotional piece, which is sort of the overarching piece that caregivers manage in addition to these other pieces. but the worries of the financial and strain and insurance, trying to understand the insurance certainly can be a big challenge. How you as a caregiver are managing your own work and responsibilities and lifestyle changes that may be occurring for you. Again, this looks different for everybody, but certainly brings an added stressor to an already stressful situation. Managing changes in the family. There are a lot of changes, whether you're a parent, whether you're a partner, whether you're a friend, this can bring on changes within your family or within the larger family as a whole, and trying to better understand what these changes in relationships and roles within a family mean. It's certainly a challenge finding time for yourself and for your own self-care. And I know we talk a lot about that, but Durene and I certainly understand that that's a huge challenge, whether it's exercise, doing something you enjoy doing, finding strategies to help you cope, and most importantly, taking care of yourself, not only your physical self, but your emotional self too. And not putting this on the back burner because you don't want to end up with medical issues and yourself, or neglecting your own care, your own physical care and emotional care. And this is often a neglected piece. And certainly with a new cancer diagnosis, the energy, the enthusiasm, the energy you have to start on this cancer journey may be full. As you go into treatment, as you move into survivorship, it's, I know we often talk about preparing for the marathon. This role isn't ending, and really trying to figure out how you're going to prepare for the long haul. Just some initial things that I'm thinking here are one of the first things you can do. This insurance challenge is identify your loved one's insurance or insurances. Sometimes a lot of family members have no idea. Does my loved one have insurance? Who is their insurer? Maybe they might have a supplementary insurance. These are really important pieces to understand. If you don't know those pieces, that's a great starting point. Even if you're making a list to yourself, it's a Medicare primary and a Blue Cross secondary insurance. I know that piece. Ask your loved one, do they know this information? Talk always, depending on where your loved one's getting treated, ask to talk with a case manager. This might be a social worker, this might be a nurse in the practice, in the bigger cancer practice, or if it's in a smaller office, ask to talk to somebody who can help you with case management. Certainly in some larger cancer centers like ours here at INOVA, we have financial navigators. So sometimes that's a really great person to just start the conversation with, because it's really daunting to try and understand. Another piece that might be helpful is have your loved one provide you authorization to be able to talk with the insurance company, because at some point this might come up, and you might not have the ability to talk and ask questions if your loved one hasn't given permission. So that might be something as a caregiver to ask about. And through your insurance companies, a lot of times they offer a case manager or a navigator. Ask to be connected with somebody, because it's always helpful to have a name and number when you're trying to understand and manage some of these complex questions and decisions that you're coming you may be facing. So identifying somebody that might help you be able to piece that apart can be really helpful. And we certainly know the world of oncology, the world of all these different medications and oral medications, these costs are huge. There's sometimes a lot of things that are not covered through insurance, and individuals and different caregivers and programs have to explore different options for having some of these medications paid for. And as a caregiver, whether you're new to caregiving or whether you're an experienced caregiver, we want to just focus on some of these strategies. Accompanying your loved one to appointments and coming prepared, have that notebook, create those lists, write down those questions or concerns. We always encourage, keep a running list of things. If it's on your mind and you're thinking about it, if your loved one, if you're noticing something about the loved one, write it down. And you always have a means to be able to express that when you come into the office. Understanding the expectation of communication. This is really important. I think in the complex world of cancer, there's a lot going on. And I think even as healthcare providers, sometimes I think we know this, we see this day in, day out. You're new to this. This is a huge change in your life. We want you to understand and make sure you understand what's going on and how the communication is going to occur within this care team. Sometimes with patient permission, always is understanding what the communication pathway is going to be. When the doctor has to relay important information, are they calling the patient? Are they calling the caregiver? What is the method that the doctor's office is going to use to best communicate these needs? Start and initiate those critical conversations. Your loved one may have never identified, or you may not know who the healthcare proxy is, who would be in charge of making medical decisions if an emergency happened. A lot of people haven't talked about these things until they've faced a serious illness, but it's helpful to have your loved one identify this with the physician. It may be you as a caregiver, it may not be, but having these things on record and having the office and the oncologist or the medical team there know that is really important. I think it's important to be able to share your challenges within your own relationship with your loved one, with their care team. That's okay, and that's real life. And it certainly helps us understand how to support all of you better when sometimes we understand some of these challenges and some of these complicated dynamics within families. From our end, whether it's an oncologist or the oncology team, the focus is always the patient. And I don't think we always explore the roles of caregivers like we should. I think and you may be experiencing this already, we expect a lot from caregivers. Not that we expect it, but I think as a society, a lot is put on you to complete tasks, to do things, to get them to appointments, to change dressings, to administer medications. It's really important, if you have limitations or hesitations, to share this with the care team. You don't want us as a care team making an assumption that you can manage all of this. And sometimes we may not explore that with you. And I think that's speaking up for your own limitations is a really important piece that would be helpful for us to know. If you're working a full-time job and can't get your loved one to an appointment 2 days a week, that's helpful information for us to have to explore other avenues, whether it's with you or whether it's maybe with our case management of helping your loved one get to an appointment. If you don't understand the medication piece and that's not your strength, that would be important for us to know. Share your observations as a caregiver with the team. This may be really different than what the patient is reporting or what their own perspective of their own health is. They may go into the office and say, I've been feeling fine. I haven't been nauseous. Everything's fine. When in reality, you may have spent the last 4 or 5 days next to them while they're retching, administering anti-nausea medications and watching them not eat a lot. Your observations can be very valuable in sort of explaining and sort of giving a broader perspective of what's going on. And Durene will just sort of pick up here, just talking about not only your limitations, but understanding your own boundaries too.
Absolutely, Rebecca. Again, this is Durene. I'm one of the oncology therapists, and this is one of the chief components of my role as one of the members of the care team, is to make sure that people do have the emotional support that they need, and also that they know that they can come to a safe space where they can make inquiries, given that this is generally a very new process for them or one that's unfamiliar to them, and also that they can be candid and transparent about some of the feelings, emotions, questions that they have about going through the process. boundary setting is so, so very important. And I use a variety of treatment modalities when I work with caregivers and with patients, but there are generally three things that I make sure to punctuate with everyone. The one is to make sure that you reach out for help. Rebecca's talked a lot about, again, how this is a new process. And as I stated earlier, your distinct title may vary. Perhaps you are a sibling, perhaps you're a spouse, perhaps you're a parent. But even sometimes when you've gone through the cancer journey with someone, it doesn't mean that it's one that you're completely familiar with, and you might find that you have varying experiences with respect to how you go through it with someone else. So definitely reaching out to your therapist or your counselor is so important. You need to make sure that reaching out for help is something that you make a priority. The second is to make sure that you're comfortable saying no. We're going to talk a little bit more about self-care, and we'll spend a little bit of time on this, and we'd be glad to answer any questions in this regard, but it's going to be so important to make sure that you don't let anyone care more about you than you care about yourself. I'll say that again. Make sure that you don't let anyone care more about you than you care about yourself. And perhaps it is going to mean that you have to say no, because making yourself a priority, making sure that you participate in self-care is going to be so pertinent to this process. After all, if you're not taking care of yourself, there's no way that you can really take the best care of the person that you're caring for. Here's the last thing I was saying. This kind of dovetails off of the second thing that I just mentioned. It's so important to be mindful of how you spend your time. And we'll talk a little bit more about that. In the interest of time, I'm going to abbreviate that comment because I do want to make sure that we move into the interventions and practical tips. But we'll come back to that point here very shortly. But being mindful of how you spend your time, and again, making sure that you're not bashful about engaging in self-care is going to be so critical. If we can move on to interventions, and then we'll get to practical tips. And I'll come back to some more distinct caregiver interventions after Rebecca.
Sure, thanks, Doreen. And like Doreen said, it's these interventions that can be key for you to sort of helping you maintain balance yourself as a caregiver. Some interventions are identifying support. Who besides you is your caregiving team? Maybe creating a calendar that may be a monthly calendar, a weekly calendar, a daily calendar. If there's multiple people involved, or just a calendar to help keep you on track. Establish an emergency plan. If you know you're going to be away, you're going to be at work during the day, who is the caregiver that's going to be first in line if that's not you? Connecting with others. Connecting with other caregivers, whether you're meeting people, other caregivers at the Cancer Center, whether you're participating in a support group like ones that Doreen and I facilitate, or different support groups that are available online or within the community, and just connecting with your own friends, learning about the specific cancer. Now, I know a lot of you have a variety of cancers that you're managing with your loved one, but there are great resources, disease-specific websites. Reputable websites to go to are a great source of learning information and getting specific support for yourself about that disease. Focusing on the future. You have to manage today, but maintaining that future-focused attitude. As Doreen said, and it's sort of I reiterated on the last slide, acknowledge your limitations. That's okay. You can provide better caregiving for yourself and for someone else if you recognize your own limitations. Accepting help, this can be really, really hard. And this can be one of our biggest challenges. But if you can identify specific ways in which others can help, say yes. Practice saying yes to some of this help. As Doreen will expand on more, taking care of yourself. As I said, acknowledge limitations, recognize your limitations, and just some basic things that you might be able to do today, organizing that medical information. Have a couple of different folders, one for bills, one for test results, have a calendar for appointments, maybe making sure you register with that electronic medical record. That can be whether we use Epic here at the hospital or a different medical record system, that can be really helpful in helping you organize information and getting you engaged with what's going on. As I mentioned, there are disease-specific websites. Certainly you can reach out to us. You can ask in the Q&A about different websites that might be helpful for your specific situation. We mentioned keeping the notebook of the questions that you might have, making sure, can you have access to a medical record too, along with your loved one? Exploring options, legal, financial, and advanced care planning support. Through Life with Cancer, we have a variety of things, and certainly we have different seminars and webinars that address some of these pieces, as well as exploring some of these things with the case manager that may be at your cancer center. Keeping an updated list of medications and understand when the medications are to be taken. This may be something that changes on a regular basis. You know, making sure you have the most up-to-date list, whether it's a handwritten list, typed list, or in an app. This is something that as a caregiver, if you can wrap your understanding around this is something that can be very helpful. Some people set alarms on their phone as reminders, patients and caregivers. This can be very helpful to assure compliance with taking medications. As I mentioned before, keeping a diary of symptoms or side effects that you notice as a caregiver, not relying on the patient or the loved one, but that you're observing. Know the contact number for the physician, for the oncologist who's steering this ship during a cancer journey. Have that number, hang it on the refrigerator. Anyone coming into the house will know. And as I know, as an oncologist, there's always somebody on call. It may not be your primary oncologist, but somebody is always going to get that phone call, whether it's Friday night at 2 a.m. and you have a problem that you need to call the doctor, that there will be a system for you to go through to have contact. And again, as I sort of mentioned, putting this emergency list of doctors' names, caregivers' names on the refrigerator somewhere obvious can be very helpful. Durene?
Great, thank you, Rebecca. So on this slide, I want to talk about 5 distinct areas that Rebecca and I prioritize. There's a very wide array of interventions that caregivers can use, but we wanted to highlight the ones that we thought were most important. The first is to make sure that you spend time researching and educating yourself about your loved one's cancer diagnosis. You do this by attending appointments. As Rebecca said, there are some reputable resources. Some are disease specific. At Life with Cancer, again, this is our area of expertise and specialty. So we do have a wide array of support groups, of educational series, informational sessions that any one of you can attend. Some, again, are disease specific, others may not be, but there are definitely a lot of tools that we have that you can put into your toolkit as you're going through this journey. We do co-facilitate the Caregiver Connection group. We have the information for that towards the end. You'll definitely get that. But that's so important because making sure that you connect with other people, if it's friends, if it's family, if it's participating in support groups, that is definitely going to be to your advantage. Again, it's generally an unfamiliar journey. And like I said, no 2 journeys are the same. You might find yourself serving in one capacity as a caregiver, but that's always subject to change. So making sure that you stay connected with people is really very important. Making sure that you are forward thinking and that you're planning ahead. Again, this has to do with the self-care, and it also has to do with how important it is to make sure that you accept this help with grace. It is here for you. And it's only going to be to your advantage to make sure that you embrace any and every opportunity that's available, either to educate yourself or at the very least to be supported while you go through the journey. One of the interventions that we recommend to people is journaling. If this is something that you could do at least 15 minutes a day, a few times a week, it's a great way just to process your emotions, to eject any thoughts that you might have. Put them on paper. Sometimes they make for good conversation pieces when you are connecting with others. Other times it's just a good and safe and private way just to again, to eject those thoughts and to process anything that you might be going through. So we look forward to any questions about that. While the journey may differ, again, there are generally some items that we hear that are very common. The one is the fear of going through the process, not knowing what to expect, in some cases, not knowing what questions to ask, just not knowing at all. And that can be very uncomfortable for people, along with grieving, loss. Sometimes because you're caring for the loved one, you might find it to be a bit isolative. And consistent with what I said about the first part, just the overall uncertainty of going through it can be a real challenge. What we do find, however, is that people who choose to be in this role as a caregiver generally find the process to be a bit more fruitful than others who might feel like they're forced into this role. And again, in the interest of time, I won't delve into that, but this is one of the topics that does come up when we have our support group, which you're welcome to attend. We'll have the information for you here shortly, or we welcome any questions if that's something that we should delve into as a group today, okay? So at Life with Cancer, we focus on every aspect of self-care: physical, emotional, social, and spiritual. So we have exercise classes. We have therapists that specialize in sleep hygiene to help with the physical aspect of it. We also have the emotional part, which is where I am very instrumental in helping with the stress management, the forgiveness, the compassion, the kindness, the education, the social aspect. One of the things that Rebecca and I have seen is that a lot of people have come to our support groups, even if it's not just the one that we facilitate, but they come to support groups and sometimes they make friends outside. So the social aspect is something that we strongly encourage and we promote, and just making sure that, again, we encourage people to ask for help, that we endorse the importance of spending time together. And as I said at the front part of the conversation, making sure that you stay encouraged as a caregiver, not only to set, but to promote your boundaries. We have a chaplain as well. So our chaplain is very instrumental in helping with the meditation part of it, the nature, the journaling that we just talked about, and just that overall sacred space that's very much needed while you go through this journey. Okay. Rebecca talked about this a short time ago. Again, INOVA Life with Cancer. We are at all of the INOVA sites. So you can always reach out to us if you're receiving that care through INOVA. The good thing also is that no matter where you are receiving care, we're here to support and to help you. I highlight that, however, because if by any chance you're on site, there is someone here that can answer any questions for you or to support you while you go through the journey. We have our online support groups. In fact, Life with Cancer offers more than 100 support programs and services that are available to patients and their families free of charge. Some of them are disease specific. We endorse that you read any information from the American Cancer Society. There's also the Caring Bridge program. The National Alliance for Caregiving has also been a really good resource. And there's also FMLA, the Family Medical Leave Act. We'll have all this information for you at the end, or you can always very simply do a Google search to learn a little bit more about the information. The next slide are also very useful resources. So I won't read them to you. As Allegra said at the beginning, you will receive this presentation. So I strongly encourage that you look at any one of these resources. You can look at them at your discretion, but there's a lot of news you can use out there about disease process and treatment resources in tandem with using Life with Cancer, which I strongly encourage. Rebecca's going to talk to us about the mobile app called cancer.net. And then I'll be glad to come back and tell you a little bit more about Life with Cancer once she's completed.
Sure. And just highlighting a couple of these, I didn't put disease-specific sites on here, but I wanted to make sure you had some resources where you could click on a link within this site about any disease. So again, starting with that reputable site for your information. These are great places to start. National Comprehensive Cancer Network. I often pass out the NCI Chemotherapy in You and Radiation in You booklets. They're really helpful. Not a lot of medical jargon, but sort of walk you through understanding treatment. ChemoCare is a great website for understanding any type of chemotherapy. It also has side effect management information. The National Cancer Institute PDQs, they have cancer information summaries on all different diseases. Again, that's a great website to go to. And the American Society of Clinical Oncology covers, it's sort of our golden standard in oncology, type cancer specific information, treatment specific information, and they bridge into even advanced care planning information as well. Again, these are all sort of provided to you, but I wanted you to have resources available within the community here for caregivers. So I put several different websites on here that have great information for caregivers. Additionally, I included in there Triage Cancer, and that they're a site that provides legal, financial, insurance, and employment education and information. You can contact them by phone, which is sometimes helpful. Cancer and Careers, whether you're inquiring about your own career and management of that as a caregiver or for your loved one, this is a great resource for you. Again, you can contact them by phone. You want to know your rights, your loved one's rights. A lot of those questions come up. Food and Friends is food delivery service in the greater metropolitan area. That's an awesome organization, and those affected by cancer can qualify. There are no income limitations or requirements that this inquires about. If you have a cancer diagnosis, you qualify. Dispatch Health is basically an urgent care in the Fairfax area that comes to your home. They typically respond to you within about 2 hours. A nurse practitioner and EMT will come out. It's billed through your insurance company, sort of the same as urgent care. They can do a variety of tests in the home and procedures. CareLinks is an organization that matches families and caregivers and can, again, sort of help with some of these needs that you might have, whether it's sort of companionship or housekeeping in the home. This is a good resource. ElderLink is a partnership between Fairfax County and INOVA, sort of providing case management and caregiving support. So that's a great resource to know about. And then on a greater note, the National Alliance for Caregiving. Again, as Doreen mentioned here, when we talk about keeping information organized, for those of you who might prefer apps and keeping things on an app, the cancer.net mobile app is a really helpful one. You can track symptoms. You can upload information from smartwatches and devices. You can collect questions in there. It gives you some prompts, some things to ask. But again, this might be a really helpful tool to have if you're somebody that likes apps, and it's free.
Thank you, Rebecca. So as we stated at the beginning, Rebecca and I both work for Life with Cancer. I am one of the oncology therapists, and she's a nurse with Life with Cancer. Our entire staff does consist of oncology counselors, nurses, dietitians, exercise therapists, and we also have a psychiatrist. As I mentioned earlier, we offer more than 100 support programs and services to patients and their families at no charge. And we're actually celebrating our 35th year of service. So that's really exciting. We're funded largely by philanthropy And just to reiterate, we do provide these resources regardless of where the person with cancer is treated. All of our information is evidence-based, and again, we're here to help as much or as little as needed. Because of COVID, we're doing so many of our programs virtually now. So that's something that a lot of people have really come to appreciate, is that you can still enjoy these services, benefit from these services, but this time in the privacy of your own home, and again, at no charge. So again, we rely heavily on philanthropy, donations, planned gifts, and fundraisers, and we're here to help patients and their loved ones who are going through the cancer journey as much or as little as they need. As I mentioned a little bit earlier, we do co-facilitate the Caregiver Connection Group. The information for that is to the right side of your screen. And on the left side, you can just you have kind of a glance here at the caregiver resource schedule. Again, in the interest of time and for space, we couldn't highlight the more than 100 support programs and services that we offer, which is one of the reasons that we encourage you to visit our website, www.lifewithcancer.org. There you will find more information about both of the items that you see here on the screen. And you would also go there to sign up for any one of those programs. And somebody would reach out to you either by phone or by email, depending on what your preference is or what the instructions are with respect to how you would enroll in these. Lastly, one of my favorite quotes is by Lena Horne, and I thought it was so appropriate for this. One of the things that she said is, "It's not the load that breaks you down, it's the way you carry it." And that's something that I've always held very near and dear to my heart, and I wanted to share that with you. But the reason that that's so applicable is not only because it's true, but it is because, again, just to punctuate some of the things that we highlighted earlier, it is so important for you to engage in the self-care, to seek the support, the knowledge that you're going to need to go through this journey. And Rebecca and I are delighted to be a part of that journey as much as you'll allow us to be. Again, you can join us for Caregiver Connection. It's every second Monday evening, or you can join any one of the more than 100 support programs and services that are offered by Life with Cancer. Some are in person, again, for your safety and for ours. Most of them are virtual. So with that being said, we thank you. Thank you for the opportunity to be able to present to you today. And hopefully we can use the last few minutes to open up for any questions. And to expound on anything that you might have more questions about or anything that we can make clearer for you. We welcome those at this time. Thank you.
Thank you, Durene and Rebecca. So as Durene just said, at this point, I would like to invite our audience to submit your questions. You can use the Q&A box on your Zoom panel, and I'll read those to the presenter. We did have a few questions that came in. This question is, how do I balance being a cheerful, optimistic caregiver with being a realistic comfort to my loved one in time of fear?
Durene, you comfortable? I think that's.
Yeah, no, I'd be glad to chime in. Just again to highlight some of the things that Rebecca and I talked about. Number one, it's very important to acknowledge and to be comfortable with the fact that there are going to be times where it's going to be a challenge for you to be optimistic. Okay, it's okay to have feelings other than those that are not happy and that are not cheerful and that are not optimistic. It is a real challenge. So it's okay to be comfortable and candid with saying that, sometimes going through this journey is not always going to be one that's pleasant. Again, the self-care is so important. And it's a multifaceted process. It's not just exercising. It's not, just eating well, just sleeping well, just spending time and doing things to spoil yourself. But again, it's spiritual, it's physical, it's emotional, and it's so important for you to make sure that you do not neglect any one of those areas that we talked about a little bit earlier in the conversation. And again, as a therapist, there are a lot of people I've worked with who've come for the very first time. They've never done therapy in their life. And we know that there are certain communities where that's stigmatized. So just being open to all of the resources that are there for you, coupled with, again, indulging in the self-care is what's going to help you to get through the process. It's not going to be easy, but it's also not impossible.
Thank you. Another question that came in was, you mentioned how grief is a normal process to happen to the caregiver. What can grief look like? What are those stages? How do you know that this is grief versus something else?
Durene, do you have some, I know with a lot of your palliative experience, this might be really helpful, certainly from a nursing perspective, but I think you probably have some good ideas on this.
Yes, I do. Go ahead. Oh, okay. How do you know what that looks like? Well, the first is that you can actually attribute it to the experience that you're having. One of the things that I find to be really important when I'm assessing people is to make sure that I make the distinction between grief and depression. Generally with depression, it's not something that can be attributed to any particular experience or episode. But with the grieving process, just the overall challenge of trying to figure out how to care for somebody, the uncertainty of knowing exactly what to do is generally how it looks. Sometimes that comes across as people being sad. Sometimes it comes across as people being angry. But there's really a wide assortment of ways that it can look. Unfortunately, there isn't a distinct way that it can be described, but usually it can be attributed to the experience that the person is having in trying to take care of their loved one and just not knowing what direction to take. Does that answer the question?
Yes, I believe so. Thank you. Another question is, when cancer is stage 4 and or terminal, would you say the dynamic of the caregiver and the loved one's relationship changes or shifts at that point?
It can. It absolutely can. And I can speak to this because I spent a great deal of my career working in hospice and palliative care. As we know, with the stage 4 and with that being the last stage, that can look a variety of ways, similar to how I described grief. You know, unfortunately, there really isn't a distinct, concrete way to label, describe, or even to identify that. But it has a lot to do with, well, strike that. What I've experienced is that I've seen that kind of move and shift depending on what the dynamics are. Rebecca talked a little bit earlier about the importance of being future focused. I have found that if people are not that way and they have not planned, that can shift the dynamic. I've seen where people who have not been transparent, candid, or open with their relatives about their diagnosis and what's to come next might affect how that dynamic goes. And then to the contrary, you know, there's some people who do plan accordingly, and they're just the opposite, in which case that process can generally go a lot smoother. So again, it really just depends. There isn't a streamlined or concrete way to describe that.
Thank you. When you lose a loved one to cancer, what type of services do you recommend for the caregiver to continue or to put in place for support?
Life with cancer. Probably goes without saying that I have a bias, right? So a little bit earlier in the conversation, we talked about the variety of ways that it can go. We talked about the person, you know, having an early cancer diagnosis, being active in treatment, survivorship. Life with Cancer has programs and support services for all of those. So definitely, you know, staying in contact with us is really very important. After all, that is our target audience. So we support that. And not only that, but I would also humbly say that there's quite a bit that I've learned, even as a facilitator. There's a lot that I've learned from caregivers. And I often see the very positive dynamic of where sometimes caregivers teach other caregivers. And there are things that I learned from them. So definitely keeping in touch with us and our support programs and services has proven to be a huge asset for patients and families alike.
Durene, just to add on to that, if your loved one who's passed was involved in hospice care, and I know Durene's worked in hospice as well, there's a lot of support, grief counseling available. There's free grief counseling available for the caregiver in that period of time after a patient's passing. They also offer a variety of grief support groups and/or I don't want to say seminars and what's the word I'm looking for? Programs where you can honor your loved one, as well as one of our programs we offer here at Life with Cancer is called Good Grief.
Yep.
And it's a well-loved group facilitated by one of our incredible therapists, Sarah Brooks. And this is her area of expertise. That, we do require that you're 3 to 6 months out from your loved one's passing so that group is most helpful to you. But no, as Durene said, in that interim time, that whether it's through hospice, whether it's privately or whether it's through Life with Cancer, we have that support for you individually, sort of adjusting to all these changes as well.
And specific to hospice, bereavement support is available at no charge to loved ones for at least 12 months. I believe it's somewhere between 12 and 15 months that hospices will offer that at no charge to the surviving relatives or caregivers.
Thank you. You mentioned earlier too, how sometimes you might go to an appointment and the care receiver is giving different information than the caregiver. For example, like you mentioned how they weren't nauseous, but as a caregiver, you're seeing them nauseous. How should a caregiver handle that? Should they confront the care receiver or say, why, is there something else going on why we're not being honest with the doctors, et cetera, when that happens?
Again, when I sort of reiterated this and brought emphasis to this is in the beginning, identifying yourself as that caregiver. Sometimes caregivers go into the room with their loved ones. Sometimes they don't. We always remember that the patient, your loved one, is the decision maker, respecting that boundary and respecting the autonomy of your loved one to make their own decisions, but also including, hey, as your caregiver, this is what I observed. Giving your information from your perspective might introduce new topics of conversation for a provider to have with your loved one. And this may be really valuable. I think as caregivers, you carry a lot of guilt. You don't want to upset your loved one. You're constantly balancing so many things. All the emotional things are sort of in your lap. But coming from a loving and caring perspective, just providing your observations as a piece of information. Your loved one may be able to explain, well, gosh, that was the situation last week I was managing, but I really seem to get control of it now. That's why I said I'm not having any problems with it. But I think it's really valuable. You never want to feel like you're going behind someone's back. Really upfront, if you can sort of bring this partnership that you're this member of the care team, and allowing your loved one to know that. Is I don't, want to create conflict, but we're a team, just sort of the team approach to sharing information, because the more information your healthcare, your oncology team has, the better care they can provide you.
Terrific. Thank you. Thank you. And we are getting ready to wrap up our time together. So again, as you sign out, there will be a brief survey. Just please take a moment to answer those questions so you can help us provide topics that you're interested in. Durene and Rebecca, thank you again so much for sharing with us with your knowledge and your expertise today. To everyone in our audience, we thank you for being here. Our next caregiver webinar will be on July 20th from 12 to 1 to discuss adult service options for aging. I hope that you can join us then, and I'm wishing everyone a terrific afternoon. Thank you so much again.
Thank you for having us. It was really a pleasure. We look forward to the next time. Everybody have a good rest of your Wednesday. Thank you.
Thank you.
Okay.
Like, and reach out if we can be of any help to you.
Thank you so much. Take care.